This animation addresses challenging themes, including domestic abuse, domestic homicide and suicide. Viewer discretion is advised. If you or someone you know needs support regarding these topics, please contact 101 or 999 if it's an emergency. Welcome to a presentation of the findings of the Domestic Homicides and Suspected Victim Suicides Year 4 report. Over a 4-year period from April 1st, 2020 to March 31st, 2024, the Domestic Homicide Project recorded a total of 1,012 deaths across 979 incidents. These deaths were categorised into 6 typologies. 501 domestic homicides, comprising 169 adult family homicides and 332 intimate partner homicides. 354 suspected victim suicides following domestic abuse. 71 unexpected deaths. 61 child deaths, and 25 deaths classified as other. Suspected victim suicide is the most recorded typology across the full 4-year dataset. The overall increase in reported suspected suicides since the start of the project likely reflects improved case identification and submission to this project rather than an empirical rise in cases. Notably, intimate partner homicides have remained relatively stable over time, representing around a third of the domestic abuse-related deaths in a year. This highlights the entrenched issues surrounding intimate partner homicides and indicates the need for further work by the police and their partners in a multi-agency collaborative effort to prevent future deaths. Examining victim and suspect demographics over the 4 years, 73% of victims were female, while 80% of suspects were male. 58% of victims were aged between 25 and 54, with 15% aged 65 or older. Suspects tended to be slightly younger. 69% were aged 25 to 54, whereas 9% were 65 or older. The majority of suspects were either current or ex-partner spouses of the victim. Notably, suspected victim suicide cases had a high proportion of suspects recorded as ex-partners. Across the 4-year dataset, the most commonly identified risk factors among suspects were mental ill health 43%, coercive and controlling behaviour 39%, alcohol use 33%, and drug misuse 30%. Notably, 18% of suspects had co-occurring issues with both alcohol and drug misuse. If we zoom into cases of suspected victim suicide, the analysis shows that there were 206 victims of suspected suicide following domestic abuse from an intimate partner, also involving an identified history of coercive and controlling behaviour. This represents 58% of the cases of suspected suicide over the 4-year dataset. Illustrating the nature of risk of suspected suicides following domestic abuse, nearly half of these victims were known as high-risk domestic abuse victims, whilst 55% had been heard at multi-agency risk assessment conferences, MARAC, as a victim. Across the 4-year dataset, excluding cases of suspected victim suicide, 54% of suspects were known to the police for domestic abuse perpetration prior to the victim's death. Within cases of suspected suicides, 89% included a history of domestic abuse perpetration known to the police prior to the victim's death. In 68% of incidents, either the victim or suspect was known to a partner agency, with mental health services being the most commonly involved, 23%. Victims and or suspects being known to a partner agency was most common in cases of suspected victim suicide following domestic abuse, which echoes findings about their visibility to the police and partner agencies, highlighting the critical need for effective multi-agency collaboration to prevent such tragedies. We urge professionals, including the police, who respond to domestic abuse, to consider how the report's findings can inform their local partnership working, including ensuring policy, guidance and training are updated and developed where relevant. Professional curiosity is crucial when listening to, supporting and safeguarding those who may be experiencing domestic abuse. Where domestic abuse tragically results in death, professionals must engage with their family members, friends and others close to them to better understand the impact of that abuse. The Year 4 report makes several recommendations to inform future work in areas such as investigation of unexpected deaths with a history of domestic abuse, sharing developing practice regarding posthumous, post-death prosecution in cases of suspected victim suicide following domestic abuse, and work to strengthen multi-agency responses to domestic abuse to support prevention efforts. The findings in this report demonstrate the devastating consequences of domestic abuse. Every single one of these deaths is a tragic and horrific loss, with the impact reaching across families, friends, and communities. We must remain committed to protecting victims of domestic abuse, bringing perpetrators to justice, and preventing these horrific crimes. Change requires collective action. Let's work together to save lives by building a safer, more supportive environment for all.